Our team met with healthcare interior designers Kate Bond and Lynn Lindley to explore biophilic design and their collaboration on a mental health inpatient care building.
I think it's best to really think about what biophilia is before we start talking about biophilic design. Essentially, it is about the human-nature connection and our inbuilt need to be within nature or part of nature. I think definitely there has been an upsurge in our awareness and our need to be within nature.
The original sanatoriums and mental health institutes in Victorian times were placed in landscaped gardens because they knew that it was better for patients to be outside. And now, of course, we're designing mental health spaces specifically with nature in mind and access to outdoors. And so it's not a new thing. It's just, I think, what's new is, especially in healthcare, is we're looking at how important it is. Again, we're revisiting how important it is and what we've lost and bringing that back. So the Silverwood project, that's an interesting one actually, because our initial engagement with the Trust to provide interior design for Silverwood, which is a mental health facility, inpatient facility in Surrey, we started with lots of engagement sessions. We did specific sets of engagement sessions with lived experience groups, staff, stakeholders, and this is way before we even looked at the artwork.
Yeah, this is before, okay.
Yeah, just to get an understanding of how people felt about space, about light, about colour, about how they work and potentially stay in a building. What is it that building needs to give them? And actually, what's interesting is we had the results of some of those sessions that we do are quite similar, depending on the different projects that we're on. But we looked at artwork in specific areas, and the overwhelming themes that came from the artwork were nature. They were biophilic imagery, and some of it was quite soft and gentle, and some of it was more vibrant. But what had everything linked was nature. And so within our project, very quickly, we then proposed areas within the building that we really felt needed that extra layer, that sort of something that was more than just colour and form and light, and that's where you came on board.
I know, but how did you actually, because there were quite a lot of walls, weren't there? How did you decide in particular?
It's about patient journey. There's a word that or a phrase that goes around we talk about a lot, and this is a journey to recovery. Yeah, we took that literally at Silverwood, and we developed a journey to recovery through the building, and we started to put a palette together of colours from the riverside and colours from the sort of the fields and the sort of the vegetation, and also the colours of the birds that we found in some of the imagery. So similar to what you do, but we weren't out there in nature, we were looking at it in digital format, I guess. So we put a colour palette together from that. We started to build upon that, but we also had the research from the engagement sessions.
With my textiles background of teaching textiles, I wanted to use a process that perhaps people hadn't done before, and so we were actually able to use real plants, real leaves within that practice. But I also think with mental health, it's really important to think about shape and about form and how we feel about those. And I know that another project had been done by somebody else recently, and I remember reading an article about them talking about shapes and it was quite interesting to see how they interpreted that. But for me, I wanted to explore a certain set of shapes and get feedback and ask those questions at the actual workshop, and try and amalgamate the nature elements and the shapes and the colours all at the same time. But I obviously was aware of the palette was all there. The palette was, so I could play with that as well.
Sometimes gets forgotten. It isn't about having a few bits of materials. It's how those items go together.
It's holistic.
I've told you about the cooking scenario, but just, all of these things that are on the table now they're all ingredients in something, aren't they? In creating something a bit like cooking is, and it's about that sometimes harmony, sometimes one element will sort of bounce off another. But I think, especially on something like a refurbishment where your costs are limited, you need that starting point of analysing and looking at, where can the money go? What will give the most impact and help in the best way? And sometimes that might be paint colour. Sometimes that might be just one piece of wall that's got imagery or design on it, or it might be about getting the wayfinding right. It's actually sometimes about getting rid of things as well as adding anything in. Over the years, especially healthcare, I guess in lots of places, but in healthcare we see endless additional bits of artwork or notice boards or information that just gets applied and constantly, and you just get this visual noise that actually, if you just take that away and just simplify the space, make it easy to understand, and then you can start to sort of enjoy it and benefit from it. It's no good just popping. One thing about artwork is you don't just put something up on a wall. It's got to be thought about and integrated, and what's it doing? You must get asked when you're doing your projects.
I think I try not to compete with everything. I think I try and make mine just fit in. I don't think what I create is super. I'm not a super brightly colourful person. I do like the odd pop of colour, but I think that I try and put myself in the position of somebody who isn't well. To some extent, I think I can empathise quite well, and I try and think, how would I feel in that environment, and what would I need? What would I not need?
Yeah. Yes. What would you not need? I think that's often something we forget. It's not just adding constantly, is it?
Yeah.
Trovex would like to say a special thanks to Lynn and Kate for joining us for this session. Their respective contact details are on the screen now. Thank you for watching.